The 70-year-old man is brought to the emergency department by his son because of a 2-day history of right upper quadrant abdominal pain, chills, and confusion. He has vomited twice during this time despite decreased food intake. The patient has hypertension controlled with hydrochlorothiazide. Medical and surgical history is otherwise unremarkable. Vital signs are temperature, 104.4 Fahrenheit, pulse of 110 per minute, respirations 18 per minute, blood pressure 100/60. The patient appears seriously ill without evidence of jaundice. Abdominal examination discloses tenderness to palpation over the liver without guarding. Results of laboratory studies are shown. Amylase of 350, total bilirubin of 2.1, white blood cell count of 16.5 thousand, neutrophils 42% segmented, and neutrophils 25% bands. Serum urea nitrogen and creatinine concentrations are within the reference ranges, as are results of liver function tests. Ultrasonography of the abdomen shows multiple stones in the gallbladder and a common bile duct measuring 9 millimeters in diameter. Intravenous fluids and broad-spectrum antibiotics are administered. What is the most likely diagnosis? So, what do you all think? So people are putting their answers into the chat. That's great. And once we get everyone's answers, we'll ask our panel to talk about their thought process, and then we'll ask Dr. Rebbecchi to also weigh in. And I think we got everybody. So who'd like to start? As I said, we'd like to make this sort of like attending rounds, except in a virtual setting.
I can go ahead and start.
Brianna, please.
When I'm hearing this vignette, I first noticed that this older man seems quite sick. So that's my first jump. I'm worried about infection as a first rule out. Fortunately, he's not acutely declining with a stable blood pressure, but and then looking at his lab, it looks like he has signs of both pancreatitis and hyperbilirubinemia with a neutrophil predominant white shift. So I'm concerned about something that tells me that there's something affecting the liver, the pancreas, and the bile system, and then there's some sort of infectious process involved. And the common denominator to all that would be, for me, something blocking the bile duct, which then allows the bacteria to rise up and lead to an infection.
Wonderful. Any others? Yeah, Brooks.
So when I'm approaching a question, I occasionally will glance down at the labs and the imaging results. Yeah, you can see the leukocytosis and the kind of the obstructive jaundice pattern. And then you can also see the ultrasound saying the common bile duct is measuring 9 millimeters in diameter. So that really limits the number of diagnoses significantly and kind of localizes where you are in the biliary tree.
Yeah, Brooks, you point out something I think is really important, both from a process standpoint when you see these questions, but also clinically as you get more advanced or more expert. What are the things that are going to draw you right away to getting to the answer quicker, especially if time is of the essence? What do others think?
Like Brooks mentioned, I think the fact that they even mention the diameter of the bile duct is important. And I think normal is 8, but even if you didn't know that, just the fact that it's in the vignette is a good clue.
Wonderful.
Yeah, I'd like to kind of comment on something Brianna said that kind of is that this looks like a sick man, and it sounds like a very simple comment, but in the real clinical world, that really matters. And then I suspect when we see the answer set, it will matter as well. In my mind, I have a couple different things that I'd be thinking about. You guys kind of all focused on cholangitis or something in that realm. Something with cholangitis is generally very, very sick, different than probably some of the things we see in the other option set. So something as simple as that Brianna kind of pointed out, I think is really important, not only when you're looking at questions on an examination or something like this, but also in the clinical world, which is really how this question was kind of written, and Miguel can kind of talk about that. We want to kind of put you in kind of the an artificial clinical environment. Things like that are really important when you see them, and I just wanted to kind of point out what Brianna said and kind of double down on that.
Thank you, Dr. Rebbecchi. I'm also thinking, as Brianna led off, I felt a little bit of anxiety in your response, and I think when I read this too, I get anxious that this guy's really sick, and we probably have to do something expeditiously. And that's, again, from a construct standpoint, that's kind of what we're going for. How realistic can we make these, knowing the limitations of the format, to try to get as close to a plausible clinical scenario that also doesn't confuse the examinee. So I'd be interested to hear from others about how you might have approached this or how you approached this as you saw it. And then we'll get to some key features of this before we reveal the option set.
I think in this question, for a medical student, it gets a little confusing when you're in the right upper quadrant, and it's really important to differentiate between cholangitis and cholecystitis. And I think as a test taker, most people will be very caught up with without evidence of jaundice and, oh my God, what's a common bile duct measurement? Like, how can I gauge that? And it's really important here to remember that Charcot's triad is not necessarily going to be present in every acute presentation. So while you do not have jaundice, which most people think cholangitis, jaundice, you do have right upper quadrant pain, fever, and then you do have the amylase being elevated. And that is a key, I think, marker that this is involving not just the gallbladder, but actually more of the area, more of the general area of the common bile duct where it's affecting the pancreas. So I think this is actually a wonderful question because it's most realistic probably to something you'll see in a clinical setting.
Yeah, I'm glad you brought up, I'm glad and I'm anxious that you brought up Charcot's triad, because then I had to remember what it was. But again, as a point about how you approach these questions, I always tell students, try to get inside the head of the person that wrote the question. What exactly are they expecting you to demonstrate? So they could have easily written Charcot's triad is positive, let's say, but this compels you to use higher order thinking skills and say, well, what exactly are those elements and how do they translate from real data? So I'm glad you brought that up, Rachel.
The 9 millimeters is an interesting kind of observation because who knows what the normal is if we're not, I think there's a radiologist in the group potentially. But I would say that there's probably enough information that if you didn't know what the measurement of the common bile duct is normally, you could still get to the right answer. So this type of question, Miguel might comment on this. Maybe, if you were going into radiology or you were a radiologist, you may have a better sense. But I don't think you need to know that 9 millimeter diameter is large to get to the right answer. There's a lot of stuff here, which I'll kind of comment on when we look at the answer set.
Any other thoughts before we reveal our red flags?
I had one thought based on what Rachel had said, that, there are these big signs that there's something significant going on here. And specifically mentioning the fever, I think when I'm reading a question, there's the quote unquote fever and there's a real fever. And that for me helps differentiate, is this just a sign of inflammation or is this a clear sign that there's something infecting this person? Because if it's just, 100, 100.5, that could just be autoimmune or inflammation, such as if this was like a liver question, it could be autoimmune hepatitis. But if he's got 104 fever, there's something going on that's infecting his body.
Brianna is appealing to the geriatrician in me, and I see a 70-year-old man. I think if he had a fever of just 100, just a skosh above 100 and looked like this, I would still think he's equally as sick, for sure. Does anybody want to comment on how you look at a question like this? And you've taken lots of NBME exams. I know that you all have, but how does it change your approach when you don't have the option set in front of you?
And I'm not sure that it really does change the approach all that much. A lot of people who, when you talk about test taking strategies, a lot of people discuss, not really looking at the answers yet and trying to come up with a diagnosis on your own first, to avoid letting the answer choices sort of sway you in one way or another. So this sort of just covers up the answers for you on its own. And then this way you could say, okay, this might be, or this is most likely what I think it is. And then when the answers come up, you might feel confident eliminating, 3 or 4 of the choices pretty quickly, given where your mind is at right now.
When I'm doing a question, I try to identify like the pertinent positives and negatives and kind of keep track of those in my mind and kind of have a rolling like differential. And then when I get to the answer choices, I can see if I didn't consider one, and then I can go back to those pertinent positives and negatives and try to see like which diagnoses explain all the findings, like what's consistent or like what's discordant. So basically using the answer choices as like a backup if you didn't originally consider it as you're reading the prompt.
That's an astute approach to avoid the anchoring or the early closure, as they say.
Yeah, when I approach a question, I start with the question, or when I approach the whole STEM, I start with the question first, what's the most likely diagnosis, to try and hone in on what I should be thinking about. Because some of the questions could be, what are the risk factors for this? And then, like it's been mentioned before, not having the answer choices doesn't really change my thinking, because I go into a question trying to remove that anchoring bias, and looking at the answer choices has the anchoring bias with it.
Great insight. Thank you for that.